in the face of a disaster, whether it's 9/11 or COVID, people quite pervasively experience distress and anxiety, and that's normal. And people need to appreciate that. And we learned that most people are very adaptive. However, there's a certain percentage of people who get sick with mental disorders, with addiction, and we have to be able to identify them. Many of them are already been in care, so we know who they are, and we have to reach out to them because they are going to be more at risk for relapse or for the development of a new disorder. Are we actually going to use this time of disruption to make for substantive change? Or are we going to keep nibbling around the edges, which we've done? And I don't know the answer to that. I think that there is promise in financing changes of services. We know that healthcare, mental health care in this country is shaped by volume-based activity. The more you do, the more beds you fill, the more you get paid. Can we actually come to a different financing arrangements? The ones that perhaps assure some platform of security for these centers. The other thing is the provision of services. Most people, from a public health point of view, don't have the very severe mental illnesses that a state agency serves. And these people do not go to specialty care, rarely. It surfaces in primary care and it surfaces in emergency departments. So that's another shift, which is the full integration of mental and addictive services into primary care, because that's where the patients are. It was an incredibly special experience, not only because of the amazing hospitality and beauty, but because it was the first time in my career where I had basically unscheduled days to work on what I wanted to work on. I knew I wanted to write a book for general lay audiences, and the impetus for that came from a lot of public appearances. I began writing, a very substantial part of it, given 8 hours a day to write, I'm a fast writer, at Bellagio. And it was my first book for the general audience. It was called The Family Guide to Mental Health Care. I had got to know many families, learning more about what families needed, what people with serious mental illness needed, because the book itself invited a lot of comments and participation in forums that I was part of.